Welcome to Bear in Mind, the Brown Psychiatry Podcast, clear, current content about mental health. I am your host, Dr. Tracey Guthrie, Psychiatry Residency Program Director and Co-Editor-in-Chief.
I'm the co-host, Dr. Camila Cosmo, Brown Assistant Professor and Co-Editor-in-Chief.
And I'm Dr. Joanna Georgakas, Psychiatry Resident and Script Editor for today's episode.
And I'm Dr. Noah Phillip, Professor of Psychiatry and Human Behavior here at Brown, and a psychiatrist at the VA in Providence.
First, a content warning.
In this episode, we will talk about sensitive topics, some of which you may find triggering. Our only purpose is to provide education and information. Our content is not to be considered medical advice. On this podcast, we have learned about a lot of different mental health issues so far, and treatments like medications, therapy, and even ECT or electroconvulsive therapy. However, we have not yet talked about a treatment that began in the 1980s and has recently become more available to the public, Transcranial Magnetic Stimulation, or TMS for short.
TMS is a non-invasive treatment that uses specialized magnets to stimulate or calm down certain areas of the brain. This treatment has been applied to alleviate symptoms of depression and obsessive-compulsive disorder, and has also been explored as an option for treating other mental health disorders. TMS is proving to be a good alternative or additional treatment for those who have not experienced much improvement with traditional medication.
Today, we are pleased to welcome Dr. Noah Phillip, a professor of psychiatry and human behavior at Brown University and the chief of neuromodulation at the VA Providence Healthcare System. Dr. Phillip is joining us to share his expertise on TMS and talk about its applications in treating mental health disorders. Welcome, Dr. Phillip. It's our pleasure to have you here.
Thank you so much for the introduction and delighted to be here.
So, Dr. Phillip, what is TMS? How do you usually describe it to your patients?
Right. So TMS, or transcranial magnetic stimulation, is using high school physics to help people feel better. And what I mean by that is that we take a high-powered magnet, we put it over the part of the brain that's involved in things like depression or anxiety or what have you, and we help those parts of the brain to work better.
So, Dr. Phillip, how does using magnets stimulate the brain? And is TMS FDA cleared?
So how this works is it helps neurons to fire when they otherwise wouldn't. And so these are targeting parts of the brain that are involved in depression and anxiety, and helping them to fire in a more normal fashion. TMS has been available since 2008, which is when the first studies showed a very clear separation or a very clear benefit of stimulation compared to a fake stimulation or a sham.
Sounds great. Who are the patients that would be more likely to benefit from TMS?
So I love that question. So TMS is currently available for people who have failed at least one antidepressant in their current major depressive episode, which is a very technical answer, which translates in the real world to basically all patients who struggle with depression, and therefore really many patients, if not all patients who have depression, could benefit.
Excellent. So can TMS be used to treat mental health conditions other than depression and other than OCD?
So TMS is also available right now for anxious depression, meaning that people who have depression and have some anxiety symptoms that come along with it. And there's an emerging literature. There's actually, in fact, decades of literature showing it works for many different psychiatric disorders. PTSD is among them. There's also there are studies showing that it can work with negative symptoms of schizophrenia, as well as difficult to treat auditory hallucinations. So TMS works very well for PTSD. And I say that based on results from several thousand veterans who've received TMS across the nation at this point, where we can get about 2/3 of people meaningfully better.
And Dr. Phillip, how likely is that TMS will help someone to get better?
So for everyone who walks in the door, I can get about 2/3 of people better, but the story is a little bit more complicated than that. Of those 2/3, about a half, so about a third of people who walk in the door, I can get life-changingly better. Unfortunately, if you do the math, what that also means is that there's about a third of people who don't respond at all. And that's part of why I also do a lot of research trying to understand who those people are and how we can make sure that TMS would would help them.
How long does it usually take for TMS to improve psychiatric symptoms?
So the most common experience with transcranial magnetic stimulation is people will start getting stimulation, and in the first week, they really don't feel much in terms of their mood. Typically, by the end of the second week, what happens is that people will notice that they're able to participate in their lives a little bit more. And then in following weeks, as we go towards a full treatment course, people tend to notice improvements in their mood, in anxiety, and in other symptoms.
Mm-hmm. So just to get a picture of these sorts of things, let's describe this for people who haven't seen a TMS machine, or could you describe what actually happens when they come into the room? Where are they sitting? What's happening? And how many sessions do they have to do? And how long does each session last?
Yep. So the most common experience is people will come in the door, and on the first day what we do is we take the magnet and we put it over the part of the brain that controls the hand. We give a little bit of energy and we make the fingers twitch on the other side of the body. And that tells us how much energy somebody's brain needs in order for the nerves to fire in the way that we want them to fire. Once we find that out, then we put the magnet over the forehead. The technical term is the dorsolateral prefrontal cortex. And that's where we deliver the stimulation. Each session is generally about 20 minutes in length. And a standard treatment course is one session daily over 6 weeks. So 30 sessions, plus perhaps a little bit of some treatments afterwards as a taper or as a taper series.
So people are coming in every day for about 6 weeks for about 20 minutes and having this done. When they leave, are there things they can't do? Are there things is there anything you have to tell them, like, okay, you can't operate heavy machinery or drive a semi-truck? Or what kinds of things do you tell them?
So unlike many other medical procedures, this is an outpatient procedure. So people will come in, they'll get their stimulation, they go home to their work, to their kids, to whatever it is that they want to do.
And they're not medicated in any way. The treatment is the magnetic stimulation.
Correct.
Okay, so let me just follow up a little bit more. Like, where are you sitting? Where when you come in and you're the patient, are you laying down? Are you in a dentist chair? What does this look like for people so they have a sense of what TMS is? Because a lot of people their imaginations will go wild, and it's really pretty a simple setup. It's a complicated procedure in what's happening, but what the patient is experiencing isn't really all that scary. So can you describe what this looks like, where they sit, what they do?
So unfortunately, Dr. Guthrie, it is very much like sitting in a dentist chair.
Yeah.
And parenthetically, over the years, I've spoken to a number of people who make these devices and kindly suggested that we use lazy boys instead, and I have never gotten them to take me up on the request.
The dentist chair it is then.
The dentist chair it is. Okay. So people will come in for their session and they will sit down in this chair. We will generally lean them back just a little bit, which makes it easier to put the magnet on the forehead. And then the magnet is placed after we do some measurements to figure out where the magnet should be placed. And then they will usually put in some earplugs because the device can be loud. And they will sit there usually with the lights off for about 20 minutes or so. And there is always someone nearby and watching the procedure just in case something should go wrong.
And does it hurt at all?
So it can be unpleasant to have it on your forehead. It's certainly not nearly as bad as going to the dentist, even though you are sitting in a dentist's chair. And we do a number of things to make sure that it doesn't hurt too much. So we very slowly increase the energy over time. And most people can tolerate it quite well. It's most commonly described as a woodpecker on your forehead, or perhaps a static electricity on steroids. And if for some reason it's too uncomfortable, it's resolved quite well with some over-the-counter pain medication.
So, Dr. Philip, we know that you have done a lot of research on that. Have you ever tried TMS? And how does it feel?
So, I'm a strong believer in making sure that I know what my patients might be going through. And certainly when you work at a veterans hospital, folks do appreciate from a cultural perspective if you lead from the front. So I will often stimulate myself first so I know what it's like before I recommend it to patients. And in fact, when people are really worried about it, because this does sound very different, I have a number of videos of me being stimulated that I show to my patients as well.
Oh, nice. And talking about like some misconceptions, could you tell the difference between TMS and ECT, electroconvulsive therapy?
Yeah, so that is a great question. And TMS is nothing like electroconvulsive therapy. So electroconvulsive therapy requires people to have anesthesia and to have a seizure and a number of other things. TMS is an outpatient procedure that is non-invasive and very well tolerated. And in fact, it is rare that someone can't get through a whole course of TMS. In fact, the vast majority of people, once they start their stimulation, go through it.
And just for our listeners, we have a full episode on ECT. It's also an effective treatment. So if you'd like to have more information, please check the episode with Dr. Olivares.
So is the technique safe? And do you, are there any contraindications that you can tell us about TMS?
So TMS is very safe. Let me start with all the reasons that it is safe and maybe put it in context for the listeners. So unlike the medications that are out there, there are no side effects from taking a pill that goes through your body. So the energy is only going to your forehead. And so when we start thinking about devices in this case, we think about the physics related to devices. And so here we're using high-powered magnets. And so we don't do this in situations where it would be dangerous to put a magnet on someone's head. So for example, if they have metal inside of their head that could heat or could move. We also don't do it when we don't do it in situations where there might be a risk of the energy doing something dangerous. An example there is for people who have problems with seizures. So anytime we stimulate the brain with anything, there is a risk of having a seizure. And so we don't do it in people who are likely to have seizures. Those are folks with seizure disorders or epilepsy, so people taking medications to prevent seizures. And we don't do it in clinical situations where people might be more likely to have seizures. And what I mean by that are folks who are really struggling with withdrawal related to alcohol. And certain street drugs, methamphetamines, cocaine, and et cetera, can be very dangerous and put people at a higher risk of seizures. Right. Let me also put this in perspective. So one of my other roles as I oversee transcranial magnetic stimulation across the VA system with a couple of my colleagues. And we have had no more than 4 seizures in the last several thousand people that have received it over the better part since 2017. And all of those situations have occurred with particular devices that are a little bit higher risk. And in clinical situations where there was certainly a higher risk situation that was happening.
Right.
And what are the common adverse events, Dr. Philip, and how do you manage them?
Yeah. The most common side effect from it is discomfort at the treatment site. Sometimes, because we're stimulating over the forehead, someone's eyebrow will twitch while the machine is on, which is a very odd experience, but it is not dangerous and it does not last. Patients are often worried about headaches because we're stimulating the brain, but truth of the matter is this actually works quite well to help headaches. And so that's really not a common side effect that we see.
Sounds great.
And what about, I can imagine people are thinking about, well, what if I have a pacemaker or any other implantable device? Is that a contraindication at all?
So the good news is that most metal or most implanted medical devices these days are safe to go in an MRI machine. And generally speaking, if a device or a piece of metal is safe to go in an MRI machine, it's safe to be around a stimulator as well.
Right.
So a patient comes in and they get a TMS treatment. Are they able to, afterward, go about their day, return to work immediately?
So people do. And in fact, what we do is we schedule their sessions usually around a time of day that's easiest for them. So for example, first thing in the morning before work is a very popular time, as is the lunch hour. And
And how does a patient get referred to a TMS doctor or get connected to a TMS clinic?
So a referral will come from a psychiatrist. And at this point, there are TMS clinics all over the United States. Many of the manufacturers of the devices have directories of TMS providers nearby. And most academic medical institutions have TMS clinics affiliated with them at this point.
Mm-hmm. And Dr. Philip, could you talk a little bit about your experience as a researcher investigating TMS applications in different neuropsychiatric disorders?
Sure. Delighted to. I mean, my mission is to design, develop, and deploy neuromodulation or brain stimulation treatments for people with difficult to treat psychiatric illnesses. And what that means in real world terms is that we spend time thinking about how interventions like transcranial magnetic stimulation, how they work, how we can make sure they work for more people, and that the effects can last as long as possible. And then also being mindful that the current interventions don't work for everyone. And so we really keep an eye on developing the next generation of technologies, of non-medication options to help people.
Mm-hmm. And how does the future like for those technologies? Can you mention about any new ones that you're investigating?
So this is one of the places where there's a tremendous amount of hope. So in the near term, for example, just talking about transcranial magnetic stimulation, we spoke about how long the sessions can be over time. We talked about that a standard course is once a day for 6 weeks. What it looks like is that we can deliver a equivalent amount of stimulation in a week or sometimes less. And this is just due to some technical advances that we've had over the last couple of years. What that means, though, is that those people who logistically can't get in, and these typically are sort of working individuals or parents with children or folks who simply, it's just impossible to make it to a clinic every day for 6 weeks, all of a sudden can have access to this. We have seen in the studies so far that this can help people very quickly. It remains to be seen whether or not those effects are as durable. And that's one of the areas that we're actively investigating. There's also advances where we're hoping to be able to target specific kinds of symptoms. So not everyone's experience with depression is the same. So some people might feel more down. Some people might have more difficulties with sleep or with concentration. And it's our hope that we can tailor the treatments to each person's experience with depression to help get them better in the way that is most meaningful for them. I would also add there's a number of other different technologies that are coming, all of whom are still under investigation, but are very exciting. These include devices that might allow us to take things like transcranial magnetic stimulation home, so people could use them at home in the comfort of their own home, and other technologies that might allow us to help different parts of the brain work better that are otherwise difficult to reach. And these will include things like using ultrasound to reach in and turn down those parts of the brain that are really driving people's depression and anxiety.
Excellent.
So we've talked a little bit already about how TMS is approved for depression and OCD. Can you explain a little bit further on which changes you tend to see after treatment for those diagnoses?
So what folks are struggling with is usually what gets better. So as I mentioned, everyone's personal experience with depression or with anxiety is a little bit different.
Right.
And what we have seen over the years is that each person has a different path to getting better, but they all really follow the same general path. And that over the first 2 weeks or so, they start to notice they're able to participate a little bit more in their lives. And then as the weeks progress after that, they notice that their symptoms are going down. And that's a very common trajectory, and is often one I'll share with my patients when they're coming in, when they're asking about what they would expect. One of the, you also asked about what different what different diagnoses or what different situations will work for TMS. And so we talked about depression, and we talked about OCD, and we talked about anxious depression. There's reasonable evidence, as we mentioned, using TMS for post-traumatic stress disorder, for PTSD. It's also currently cleared as an aid for smoking cessation to help people stop smoking cigarettes, and that is relatively new. There is some exciting and up-and-coming literature that looks like TMS can help people with other substances as well. It's not quite ready for prime time, but it's very exciting. And the other area that we think about this a lot is in individuals who can't take different kinds of medications, or maybe in medical situations where it's complicated. There's two groups there in particular. So one are older individuals who already are struggling with taking many, many medications that have many different side effects. And often we will use transcranial magnetic stimulation in those situations to avoid adding yet one more medication into an already complicated medication regimen. I should add, the last time that we have looked in our data, TMS does seem to work perhaps a little bit better in older individuals. So it gives folks a little bit more hope when they're already in a difficult situation. The other group of patients that's worth talking about are pregnant and breastfeeding women. So despite all the things that we can do in psychiatry, there is still a lot of difficulty around using medications in those situations. And this allows a non-pharmacologic option for those individuals who can't or won't take medication during the pregnancy or breastfeeding period.
Very exciting stuff coming down the pike. Really cool. So are there resources that you'd recommend for people to learn more about TMS? If they've been sparked by our conversation today, where could they go and learn a little bit more about where they can get TMS?
Right. So the first thing to do is, of course, ask your doctor, and they can refer you to whatever local resources there are. There are a number of different registries that are typically run by manufacturers. But they do keep a list of people who give transcranial magnetic stimulation in the area, and most academic institutions will have folks that they use, or a clinic that is embedded in there that is in their group.
So are there any indications that wouldn't be appropriate for TMS treatment?
So there are a few, and these are important to know. And the first and foremost are individuals who are struggling with bipolar disorder, where they can get very manic. This is one of the situations that transcranial magnetic stimulation can make that worse. There are ways to make sure that that does not happen, but that has to be a very lengthy discussion with a physician. Individuals who are also struggling with alcohol and drugs to the point where they are withdrawing on a regular basis, this can also be dangerous. And individuals who really struggle with taking their medications on a reliable basis, this can also be very challenging, because the medications can change that amount of energy we use to have someone's finger twitch. And so what I'll often do when folks come into the clinic is I'll just remind them that the medications need to be stable. And if there are changes, because life happens, we just need to know about it. And then we just check the finger twitch again, and it's no big deal.
And how about people that are struggling with psychotic symptoms?
So the other consideration in this space is that individuals who struggle with psychosis or schizophrenia and related illnesses, this is not a first-line treatment for that. It's really important that they engage in other evidence-based treatments for it. And if those are unsuccessful, their psychiatrist can talk with a transcranial magnetic stimulation provider and help figure out if it might make sense for that patient.
Excellent.
And what about locally? So for people who are listening locally here in Rhode Island, where would they be able to access TMS if there's something that they were interested in pursuing?
So I am delighted to mention my friend, colleague, and prior mentor, Linda Carpenter's clinic here at Butler Hospital. It is a fantastic and evidence-based transcranial magnetic stimulation clinic. It has been around since the first days where we had machines, and works quite well. So I'd encourage people to start there. There are a number of other groups in the community that have TMS devices. There's a handful across the state at this point. And of course, if someone is a veteran, we offer it here at the VA in Providence. Most VAs across the system at this point have a device in some form or another. Yeah. And our colleagues at Lifespan have a great TMS clinic as well.
Wonderful. Okay. You know, these treatments can tend to be expensive if they're not covered by insurance. So can you tell us which diagnoses that you're providing TMS for is covered by insurance, which it depends, sometimes maybe, and which are not, so that people have a sense of what they might run into if they were pursuing TMS?
So TMS for depression is very clear and is covered by insurance and most providers in the Northeast. And it's important to note that insurance coverage or Medicare coverage changes depending on where you are in the country. So important to know what the local environment is.
True.
So depression is very clear. Some insurance will cover it for OCD, but not all. And the same story goes for smoking cessation. And one of the reasons for that is that this is a much newer area of psychiatry. And this is something different than what insurance companies are used to dealing with and used to paying for. That said, expressing my personal opinion, this is an intervention that comes with very little side effects and very little other problems and works well. And it's certainly my hope that everyone can have access to it.
Yeah.
So looking to the future, any promising directions for TMS treatment?
So one of the other areas that's very promising is helping with suicidal thoughts and behaviors. And when we give large amounts of stimulation in a short period of time, it looks like it can reduce these kinds of thoughts and can reduce them quite quickly. It's our hope that in the future, this is the sort of thing that can be offered in more emergency environments to help people get better quickly and stabilize them as other things can be brought to bear.
Wow. Thank you very much, Dr. Philip. This conversation was really helpful. Now, a take-home message to bear in mind.
So today we learned a lot more about TMS and how it's used and who it might be a good fit for and what it looks like. As we discussed, TMS is a promising, non-invasive, and generally safe option for those who have tried several medications without much improvement. It uses a magnetic pulse to change how the brain works and has helped patients with depression, OCD, and other mental health conditions. And there's more on the horizon coming our way.
If you or someone you know is feeling depressed or having suicidal thoughts, please contact the Suicide in Crisis Lifeline or call or text 988 or access 988lifeline.org. The Lifeline is a 24-hour toll-free phone line. You can also go to the nearest emergency room and ask for help.
Thank you for listening to our podcast. For more information related content, please check out our Instagram, X, Facebook, and YouTube channels. Bear in mind the Brown Psychiatry Podcast. Thank you.
Thank you.